Well, the heat is on the U.S. House now that the Senate has postponed work on a health care bill until September. But will a House vote happen this week? And if so, what can we expect? We've got Democratic Congressman Joe Sestak of Pennsylvania and Republican Congressman John Culberson of Texas to join in. And let's start with you, Congressman Sestak. Nancy Pelosi, I'm trying to figure out the signal she says she wants to, when she brings a vote, it will pass. Is it going to happen this week?
Boy, I'll tell you, it's a real close call. We've got to get it out of the Energy and Commerce Committee, but I honestly believe we've got to really try. And the reason is that the healthcare system is unsustainable the way it is. And the House bill actually does three very good things. First, if you have insurance, it lets you keep it and increases the benefits. Like my daughter who had a brain tumor. When she's 18 and I can't cover her, it now permits no refusal. It doesn't permit any refusal for pre-existing conditions. And if you're a small business today, you pay 18% more than you do for a big business because you can't pool your risk. And we address that. And second, for the uninsured, you know, you and I are paying for them anyway. $1,100 for a family of four to pay for the uninsured when they go to an emergency room. Well, let's bring them in. Let's be honest about it. Pay for it up front, and eventually they get the preventive care. And finally and last, I'm sitting in Philadelphia. And 70% of all private health care plans here in the Philadelphia region are held by one company. It's a monopoly. Let's have a public health care plan option that actually gives us competition, all in a deficit-neutral budget proposal, except for the 21% cut on Medicare for physicians this year, which we should pay.
Congressman Culberson, the House bill that Congressman Sestak is talking about could have some major consequences, the least of which are for ERISA. Explain how dangerous that could be for employers and employees across this country.
Alexis, you're exactly right. I hope for the country's sake that this terrible piece of legislation fails, because remember your previous guest, who quite correctly was talking about the information we have from the Federal Reserve's June board meeting, where they predict, the Federal Reserve predicts, this will be a jobless recovery, no new jobs for the foreseeable future, very low, if any, economic growth. And on top of that, you have to remember, as your guest said, that the country today is facing the biggest debts, the biggest deficit in our nation's history. Now, I had to vote against $2.6 trillion of spending under President Bush. I've already voted against $2.5 trillion here. The point there is, I'm one of those fiscal conservatives. I worked for Texas and my district, and this Congress, it's an absolute fact, Mr. Sestak's liberal majority has already spent more money in less time than any Congress in history. They've already passed the biggest tax increase in history with the energy tax, which is going to jump energy prices about $3,000 a year. And in addition, Mr. Sestak's liberal majority has enabled the Bush tax cuts to expire at the end of next year. So the country needs to know that we have already, because of this new majority and this new president, they've already put us in a position as a nation. We're saddled our kids with the biggest debt in history, the biggest deficits in history, the biggest spending spree in history, and the biggest tax increase in history. And now they want to let the government take over my health care system. It's just outrageous and unaffordable.
Let's go back to the issue, though, about health care. Do you think that Congress needs to work, Congressman Culberson, do you think Congress needs to work on fixing the government's role that they already have, or fixing the parts of our health care system that are not working well?
We have a crisis of cost in health care. We don't have a crisis of quality. We have the world's greatest health care system, and we need to start with the premise of do no harm. I don't want anyone between me and my doctor. We cannot permit this bill to pass because it'll put a government bureaucrat in between you and your doctor and drive up the cost of insurance, of health insurance, dramatically for small business owners, for sole proprietors. This is it's not deficit neutral. As Mr. Sestak is not, his comments don't square with reality. And it's important to remember the spending, the deficit, the debt, and the tax increases we're already scheduled for, because when you talk about health care, you're now talking about a $1 trillion government-run health care system like Canada, and we can't afford it.
Right. Congressman Sestak, you know, the Congressional Budget Office says it's not deficit neutral, the health reform, $289 billion. The president has yet to acknowledge that in speeches. The Democrats have yet to really acknowledge that cost that the CBO is saying, especially when you don't have tort reform. You're basically putting defensive medicine practices onto the backs of the U.S. taxpayer. How come the Democrats won't address these issues right now?
Well, if you noticed, Alexis, I did. Remember what I said was that we have it deficit neutral except for the 21% cut in Medicare for paid physicians. That is the $239 billion. Everything else, the CBO said, is paid for by savings or by the revenues that we gain by the surcharge we have. Now, that $239 billion should be paid for, Alexis. I agree with you. I actually put a press release out saying we should pay for it. But that would have happened, that cut, just like the 11% last year, anyway, without this health care reform. The issue is this. Look, call me a liberal, call me a conservative, but I believe that doing nothing is no longer an option. 86% increase in health care premiums in the past 7 years in Pennsylvania.
All right, but quickly,
yes,
I hear what you're saying. It's Liz McDonald, and, you know, Alexis is a terrific interviewer, and she would ask the same questions. But I hear what you're saying. But Congressman Culberson, quickly, you know, you got to wonder whether this health care reform package as it stands right now can really go through. Cost savings didn't work in the past. We're talking about getting the 800,000 doctors to step up to do cost savings, 5,700 hospitals to step up to do cost savings. Is that doable?
It's not going to happen. I hope this plan does not pass. We cannot afford it as a nation. Our kids cannot afford this, and our health care can't afford it. We don't want anybody between us and our doctors, and I can solve this whole thing very simply. Let me just ask Mr. Sestak if he would commit here publicly, if you vote for this plan, Mr. Sestak, will you give up your congressional insurance? Will you give up your private Navy doctor that works with you and and go on the public plan? And Mr. Sestak, will you let the House vote on that Republican amendment for all of you who vote for it to go on the public plan like the rest of America?
We'll leave it there, gentlemen.
No, that's
Thank
okay.
you.
I don't mind. I actually voted for that amendment when it went through my health, employment, labor, and pension plan that, yes, Congress should go into this. But please let me just finish one aspect. This keeps the patient directly with the doctor. Keep your health care plan if you want it. And that's what it says. We can't keep having assertions here. We've got to, Alexis and Tom, begin to deal with the facts. And this assertion about government intervening is absolutely not true if you walk through the plan. Keep your plan. ERISA, we protect ERISA by mandating that we have to keep big employers having health care plan. The facts have to prevail in the end because Americans are suffering, as small businesses are, without health care coverage.
All right.
Look at the CBO report. Thank you.
Congressman Culberson, Congressman Sestak, thank you, gentlemen, both very much.